Thank you for attending the Wellness Summit. I am Dr. Sarah Carlson from the Carlson Dental Group in Stillwater, Minnesota, and this is my licensed dental assistant, Jerica. She's going to be helping me hopefully explain a few things to you today about stress headaches and how TMJ disorders can play into that and how a dentist may be able to help you get some relief. All right, well, Jerica, it's nice to see you today.
Thank you.
So tell me, what brings you in?
Well, I've been having really sore muscles, which lead to headaches and just a lot of tension.
Tell me a little bit more about that. How long have you been experiencing that?
Well, a while now, but definitely in the past few months, definitely getting worse. And it only ever feels better if I take ibuprofen.
Okay.
Yeah.
Has anyone ever talked to you in the dental profession, suggested that maybe you clench or grind your teeth?
No, not really.
Do you think you could maybe clench or grind your teeth, or is this a new idea?
Yeah, I've been a little bit stressed, so I do probably. And in my sleep, I don't know.
Okay. Okay, Jericho, well, we're going to go ahead. We're going to do just a limited exam today. We're going to see if we can learn a little bit more about, what may be contributing to these stress headaches and temporomandibular disorders that you're experiencing.
Okay.
All right, so I'm going to do just first a little check of the muscles along your neck, side of your head, and around your jaw joint.
Okay.
So I'm just going to palpate. I'm going to check things out here. I'll have you turn to the left. Let me know if there's any tender spots or if you feel any trigger points, pressure points, anything that has been bothering you.
Okay.
Okay. The other side. So we're checking out your sternocleidomastoid here, very big muscle along the neck. And we're also going to check under your chin here. Submentalis. It might be a little ticklish. You doing okay?
Yes.
Okay. You feel like you're holding tension anywhere?
Yeah, those muscles right there for sure.
Okay. So we've got some tension and some very well-developed masseters. It's the big chewing muscle that comes down the side of your face here.
Yeah.
If you go ahead and clench, you can feel this big band. A lot of times there'll be some trigger points in there, so that's actually some good areas that you can do some self-care at home.
Okay.
Not so much the clenching, but maybe just kind of find any of those hard little points. Just kind of put some medium pressure on there, maybe hold for 10-20 seconds. See if you can get those spots to melt a little bit, and then you can also use just some firm pressure kind of to try to elongate that muscle as well. And then how are you feeling around more in front of your ear here?
Yeah. Oh, I can tell that they're angry.
So we've got some angry muscles
Yes.
there.
Yes.
Okay. So how about up in your temples?
Yeah, I do probably hold some tension there for sure.
Feel that. So all of that is kind of this big fan muscle, your temporalis, big masseters, posterior masseter around your ear here. We've also got some muscles called pterygoids, and they kind of work around your cheekbone and help open your mouth.
Yeah.
So why don't you go ahead and open real big for me and close. And I can hear you've got some clicking in your jaw joint. So I think with the clenching and the grinding that you've been experiencing and kind of habitually doing under stress, things are kind of just bunched up with the muscles and putting some pressure just both on the muscles and the disc around your joint. So we're going to go ahead and just make some measurements of your range of motion here.
Okay.
So we've got just a single-use ruler, and if you can go ahead and just open real big. We're about 48, which is within the normal range. That's great. Do you ever experience any locked jaw, they're being locked open, locked closed?
Never locked, but sore jaws.
Sore jaws. Okay. So we'll also check and just take a peek at how far you can move your, sorry, move your chin left and right. Go ahead, and we're gonna follow, there you go, and hold, we'll just get a measurement. And we're about 8, and bite together again. And go to the right. Sorry, you can open a little bit and then slide to the right. Yeah, so again, even side to side, we're not having any restriction of movement, which is great. Kind of indicates that the disc is in pretty good health and that what we're dealing with, you know, as far as the headaches and the sore muscles, truly is just a sore muscle issue. I'm gonna set you up a little bit here and I'll demonstrate using a deprogrammer, which is something that we can just make fairly easy in the office. And we're just gonna set it over Jerica's front teeth here. I'll pitch you upright a little more. And just a little bit kind of fits over those front teeth. And I just have you in kind of a neutral rest, I guess, really. And you can let your lips close if they want to close. And what we would do, just to kind of confirm that this truly is a muscle issue, would be to just let Jerica sit and relax for 10 or 15 minutes. Okay, so we've got the deprogrammer out of Jerica's mouth, and you know, she's feeling a lot better in the muscles. Feels like she would rate her headaches as just a little bit lower, feeling less tension around those muscles there. So you know, that would, you know, just kind of help point us in the direction of, you know, yep, we've got more of the muscle issue from, you know, the clenching, grinding, and the stress there leading to those headaches, and not necessarily an anatomical problem in the sense of, you know, the temporomandibular joint itself, either the bones or the disc there. So what we would do is recommend making a night splint. A night splint is made custom to fit over a headache sufferer's top teeth, and it will keep their back teeth from coming together at night. It's just intended as therapeutic use to kind of get people out of an acute flare-up of their muscles, help have some relief from those headaches, and really just meant to be an 8-hour max over the course of probably a couple weeks. And then we could work on checking into a couple of other issues once those muscles have calmed down. There are other reasons that people might be clenching or grinding, and with that we can get into possible disordered breathing, airway issues, sometimes tongue ties where people don't have a full range of motion with their tongue. It can actually affect the entire fascial system and lead to a lot of tight muscles and contribute to headaches also. So there are a few other directions we can go in trying to help people have optimal health and have less trouble with stress headaches. So with that, thanks for listening. Sarah Carlson, Carlson Dental Group.